We're thrilled to have with us today Hoda Ali. Hoda is a human rights activist and an FGM survivor. She's also the co-founder of Vavengers, short for Vagina Avengers, an FGM awareness group in the UK that helps support girls and women who've undergone FGM. Hoda also appeared in a British Academy of Film and Television Arts nominated documentary titled The Cruel Cut, and in 2018 was nominated as Amnesty International's Human Rights Defender. During the webinar, we will discuss what FGM is, the impact it has on girls and women across the world, and talk more about Hoda's inspirational journey.
First of all, I must say thank you so much for having me, and thank you for putting this webinar together, because it's something that really needs to be talked about, and at least if we can reach for one person to be educated about, you know, FGM and you know, rights of a child, then we are doing a great job. So well done, and thank you so much for having me. And FGM stands for female genital mutilation. It is there's many different types. There's main four types. There's type 1, which is a cut or a slit of the clitoris. And then there's type 2, which is sometimes total removal of the clitoris and partial removal of the labia minora, and they will stitch about like halfway. So I'm a nurse, so if a patient comes to me who have type 2 FGM, then I'm able to examine that patient. I'm able to and do an speculum examination. Then there is type 3 FGM, and type 3 FGM is total removal of clitoris, the labia minora, the labia majora, and then what they do is that they pull the skin together and stitch it all the way down until they leave a little hole for a little girl to either, you know, to pass her urine and to have a period when she gets her period. And type 4 is anything to do with changing the female genital area for non-medical reasons. So if this is stretching the labia, and certain countries, they think it's beautiful to have a long labia, so they will stretch as a baby girl's labia, and keep on breaking the tissues and around the labia, and they will do that for years on end. And then some certain communities, after they stop the stretching, they will bend around the vagina and the labia. And in here in the UK and in the Western world, we have labiaplasty as well. And labiaplasty is what they call and you know, making the vagina beautiful and all of that, the reason they do it. However, it happens for non-medical reason, and I don't really care like what people do when you are an adult, what you do to your body, that is up to you. However, is the message we are passing to our little girls, the message we are passing to children is what I'm actually against. So yeah, that is what FGM is. Normally, FGM is performed by cutters who are paid to do so, and that is their job. So normally, I'll give you. So I'm a survivor of FGM. It happened to me when I was 7 years old. And what happens is that it's a big people. They're celebrating. You're becoming a woman. You're going to have this procedure. And I remember we had, you know, the day before the big party, you have your henna done, you have your hair done, you get a lot of gifts from people, and then the next morning the cutter comes, and this cutter is a woman who's been cutting women all her life. That is what she knows. That's how she gets paid. Yeah, and then she comes and she performs the cutting. We were lucky, she performed at home with me and my little sister. My family could afford local anesthetic, so they paid her a little bit extra to actually give us a local anesthetic. But as a nurse now, that horrifies me when I think about somebody who was not a medically trained were able to administer medication on a 7-year-old child on her private parts. It's really horrifying when I look back, but that's what happened. So FGM is performed to really control a woman and a girl's sexuality. That is why it is performed. Growing up in Somalia, and we had great life, and every time you go to school, it's like, hey, when is it your turn? When are you gonna have FGM done, Hoda? You know, so I will run back to the house and I will ask my mom, because that's what society waiting from us. That is, if a girl gets to the age of 8, she should have had FGM, because every single girl in that country had it. You know, it was, for me, I was actually shocked when I find out people, you know, from the Western world, or people like, you don't have practice FGM. Because to me as a child, it's something that I thought that happens to every single girl around the world, regardless of what your beliefs are, what your color are, where you come from. So yeah, so basically it is to control women's sexuality, is to make sure that you don't have sex before you get married, and because it's to prove to your future husband that you have never slept with anyone else. So that is what it is. But it's as well is, if it's not being done, my family wouldn't be part of society. I wouldn't be able to go to school. I wouldn't be able to have friends and, you know, have, you know, friends and stuff like that. My family will actually be disowned by the whole community. So it's that pressure of people practicing harmful practices, but not really knowing why they're doing it.
Yeah.
So, yeah. When we talk about FGM, we are talking about over 200 million women and girls has gone through this procedure, right? Not each one of us will have the same medical problems or psychological problem. Each and one of us, when you speak to, will always tell you things. So I'm gonna share me, because that is what happened to me, and which is the medical side of it, because I was very lucky. I had the psychological effect. However, I had every medical problems that I can have, and maybe because I was in a survival mode as a child, that I didn't think about the psychological side of it. So for me, at the age, I was cut when I was 7, and at the age of 11, I started getting sick. And when I got sick, no one knew what was happening, because I had a lot of abdominal pain. At this time, the civil war started in my country as well. And so my dad he found the hospital. We got there and they said, oh, I had an ultrasound, and I'm 11 years old, right? Because they didn't know what was wrong with me. And when I had the ultrasound, they said they could see a shadow on the screen was growing. So they said to my parents, she needs to have an operation right now. This is growing and we need to operate it. It's only when they took me to theater to operate me that they realized the shadow they see was my period that was accumulating inside, because it had nowhere to come out. Now, I'm 11 years old. They came out, they told my parents what happened. And they said to my parents, because she had the defibrillation, because I had type 3 FGM. And, you know, when we said, like, we can have defib with all these different operations, no one can bring what was taken away from you. But what it does is that, especially when you have type 3 and your vagina is basically stitched shut, it's just reopening the stitches. So it's just reopening the stitches, being able to examine that patient, being able to see the urethra, being able to, the patient to clean themselves, to have their period. So for me, that is, when they came to tell my parents that they find out it was my period that was accumulating inside, my father, first of all, did not want us to be to start with in Somalia. My dad was against FGM. A lot of people always said, you know, the men are the one pushing. There are a lot of men who are against FGM. However, FGM does happen for a man, because it's to prove to your sexuality. But when that happened, my dad was like, I want my daughter to get better. So whatever you have to do to make her feel better, do it. And yeah, so I had an operation. I had an abdominal operation, and they thought, right, wait for your cycle. And I never knew what cycle was. I knew that I have to wait a couple of weeks to see if I'm going to get period, and that never happened. So from the age of 11 to 17, I was in hospital in Somalia, in Djibouti, and the last operation, which was my 4th abdominal operation, the doctor said, we cannot operate you anymore. We need to send you to Italy because we have a better equipment and stuff. And all this time, what they were trying to do was just to get my period to come out and I can have it naturally because I was sick. And yeah, so we got, me and my dad was sent to Italy in Milan. I went in there, had an operation at the age of 17, and with abdominal operation that I had my period naturally. I woke up one morning and it was there. So yeah, so that, to me, that is my story of my period being accumulating from the start. So I didn't had when the cutter cut me, because a lot of girls actually bleed to death for the first 48 hours of being cut. I survived that. I survived that first couple of years. But for me, it's when my period was starting now, it wasn't coming out. So then it affected me from the rest of my life from there. And now my little sister, who was, me and her was cut at the same time, it's okay. She had her period naturally, but it's very painful. She's got 5 kids. So everybody, it affects differently. Then I have, my other cousin is, a lot of people I know is, they don't have the medical effects, but what they have is the psychological effects. They remember them being a children, and the people that who love them, the people that would take care of them, were the people that were putting these little girls down to the, pinning them to the floor, so this woman can cut them. And they didn't have local anesthetic like I was lucky to have. These children were cut, they were up, and somebody pinning them down. So can you imagine growing up to that, and nobody talks about it? Nobody says to you that, you know, what happened to you wasn't right, you know, or how did you feel today? Nobody talks about it. So imagine now that that 7-year-old, that 6-year-old that was pinned to the floor by the woman is now 30 years old, and still she don't have an answers. So it's different, but the one thing we can really put and say, this is the long-term consequences and this is the short-term consequences, because once you are cut, once you go through FGM, it will scar you for the rest of your life. How you deal with it is, we are different people. I'm lucky to have my family who never cut in, because Jimmy stopped with me in my family. I'm lucky to have a husband who is caring, who is not from the practicing community. And when I was at the age, I got married at the age of 26, but at the age of 31, I was told I can't have children. This is after many cycles of IVF, and I miscarried my first time, and then I had pelvic infection where I ended up in intensive care unit, which, because all the additions, all the operations that I had as a child is now affecting me as an old, you know, a grown-up woman. And I remember that at the 31, when they said, sorry, you cannot have your own child, like, no, because if we touch you, it can kill you. And, you know, my husband was that with me, and, you know, that was supportive, and we are all here for a reason in this earth, regardless of if you can give birth to your own, or, you know. So for me, is that I always look at the bright side of it. But if there's anybody who's a medical who listening to this, please look for one thing: is it can be many different things. And if you spoke to a patient yesterday and you speak to another patient today, their story and their feelings and their medical problems and their psychological problems can be totally different. So always just treat every woman as you see her, as she comes to you. There's 2 things there. There's one, the justification of how do you justify doing this to children, and then there's the other one, why the people are still doing it. If I say that you look right now in the world, women are suffering, regardless of if it's FGM, if it's sexual abuse, if it's a, you know, it could be, women are suffering every country in the world. If you are a rich country, if you are a poor country, we are all going through the same thing. If you're black, if you're white, we are all going through the same thing. And that is just fighting for our rights. That is just to say, you know what, I'm a human being just like you, right? And this is what I'm doing. Let me just be, and just be me, and do what I am here to do, right? But however, being a woman is like, It's different, right? So that for me is something we are globally sharing as a woman. I don't know how the policymakers and the people who come up with these things think they can exist without a woman, because trust me, they came out of a woman. Without a woman, the earth will not even exist. So I really don't want to even pay, I don't even want to waste a lot of energy on that one, because we all know where we stand, and we're going to stand up, and we're going to make sure that our voices are at least heard, and we're going to do what we're going to do. Now, that is that. The other one is, so I'm 42. I'm going to be 43 in February. And when it happened to me long time ago. At that time, because I spoke to my mom, my father was against FGM because he knew it was nothing to do with religion. He knew it was nothing to do with anything. It was a cultural practice that was adopted into our culture. And when people make certain things, it's a cultural, it becomes normal. Nobody stands to say why. And there is an unknown saying as well that says, cultural acceptance does not mean accepting the unacceptable, right? But these people is, oh, it's our culture, we need to do that. Now, no one questioned. Nobody said, hold on, this isn't harmful. Children are dying. Girls are dying. Women are dying in childbirth. Children are being born, stillborn, because they don't have the vagina cavity to come out because you shut it closed. Nobody was asking those questions. So guess what? It become the norm. It become normal. Now, when I spoke to my mom, it was a religious reasons. She actually believed it was written in the Quran to say that girls should go through it, because apparently Prophet Muhammad has done to his girls. That is what was told to them. Now, when they started, like my mother started reading the Quran, when she started educating herself about the religion that she believes in, she realized FGM have no place in anywhere. In every religion, one thing they have in common actually is, do not change your body other than how I made you. So when they realized that, the ones who were cutting their girls because they believed it was religious reasons, they really stopped. They were like, no, what we're doing is harmful and it's not allowed. But then you have the ones who say, no, we have to do this because it stops girls sleeping around. It stops girls going and, being wild. Like, what does that mean? If you watch The Cruel Cut, if any of you watch The Cruel Cut, there's the part where Layla is asking the boys about what they think about FGM. And these are British Somali boys who were born here, who were educated here. And they said, it's good for them because otherwise the girls are like supermarket. Like you could just, what they mean is the girl's gonna sleep around. But the fact that a young man, a young teenager can think about a girl or a woman like that if they not cut, they like a supermarket. That alone to me was where things have to change. And yeah, some people will do it because they really, really believe it will stop girls sleeping around, and they will get a good husband because the husband will know that she's a virgin. Everything else, I really don't care, because anybody can come out and say, this is why I do it, this is why I do it. None of it is justified. But the main two things they do it is to control the sexuality, to control my sexuality, and to make, and the other side was like women like my mom, who was not educated about the religion, who thought it was actually religion reasons we have to do it. By talking, like what we're doing right now is a step. We need to break those boundaries where we know there is a harmful practices that are happening to girls and women, but we chose not to talk about it. I think by talking about it, by us, even all of us being in here today, it's a start, because each and one of us have a duty of care to our other fellow human being. We need to stand up and we need to really do that. But one thing that worked for me, and I would say this because it might be easier because I'm a survivor, but one thing that worked for me was that I didn't want to talk about FGM with the cultural context and why they do it. I talked about the health consequences. That is what happened to me. From the age of 11 years old to the age of 17, I was in hospital. My rights as a child was taken away from me. My rights as a child to be a teenager, to be able to go and play with my friends and go to the cinema was taken away from me. And my right to be a mother was taken away from me, because no one, absolutely no one of who you are to take that away from me. So if we talk about how we are talking about, if we talk about the truth, year grandparents, grandmothers, or great grandmothers, that when I was asking them why they do FGM, and the main thing they will say is that because I don't want the girl to sleep around. But then I said, is it justified that that girl can end up with all these health consequences like I went through? Because that is why I decided to use me. I can read from a book and tell them. But when you're sitting in front of them, when I show them my scars, when I tell them that my child, for me to be a mother was denied. So is that what you want for your future children? People start thinking. People start talking. People don't want to stop FGM. Is they know nothing about, they don't know where to start. So they start is us talking and us sharing and talking about how we are affected. If you have the FGM, the psychological effect, please talk about it, because that will help thousands and thousands of women. That will help thousands of girls who have not been cut yet. So for me, using my health, and a lot of people, it can end that way. But we just have to make sure we keep doing it, because it's no point making the momentum have to be there. We can't just do something and it goes there and then it comes back. We got to keep the momentum in order for us to speak for those girls who do not have the voice. When it comes to the woman and a man, I think this is something that everybody can say it, regardless of where you come from. The minute that you start talking about women's body parts, private part, man will just shut it down. They will like, no. We need to talk about this. You need to kind of sit back. So I think it's always going to be harder when you're talking to a male when it comes to a female body. And it's easy when we're talking to women, because we women, even if you don't go through FGM, we always have something in common. You know, you might have a horrible period pain anyway. You might actually feel like horrible the week before your period comes. We always have that connection as a woman, regardless of where we came from. And with men, though, it's easy for me. I'm a daddy, so I always been with my dad. My dad is, again, when we left Somalia, and to come to Italy for medical help for the last operation I had, which was lunch. My dad's there with me. You know, he was the one translating, because he speaks Italian and stuff. So I'm always that closer. So I always felt at ease to speak to a man, even if they don't want to hear what I'm talking about. But things are changing now, I think, especially when it comes to the medical, because that's what I talk about. I educate doctors, I train doctors, midwives, nurses, anybody who works in health. I make sure they know what they need to know. So yeah, but the question is, we're not there yet when it comes to a man. I think that's what I'm trying to say, that we're not there yet when it comes to talking to the opposite sex. And why it happens, because a lot of them still believe like, oh no, it doesn't help me. But I always said, if you come to the fore and you say, I don't want my woman to be cut, I know for sure FGM will end within a generation. Because that is for you. It's, oh, but it's not for me. So the conversation is happening, but they don't want to be seen. They don't want to be at the forefront. And yeah, but it's hard. It's always been different when it comes to men and women. My family was always behind me. Like I said, my dad never wanted us to be cut. So, you know, he was against the practice. And my mom, learned the Quran, like I said earlier, but she learned a lot more when I was in hospital, because when I was in hospital, the war was happening. There was a civil war, there's bombing and shooting and stuff. So she would have to come from home, find the hospital and stuff. And it was the doctors of talking and telling that your child is sick because of something that was done for cultural reasons. That kind of really stopped on my family. So I didn't have to convince my family or talk to them. It's just that witness that what they saw. And I'm still going through it. Because at the age of 37, I've been diagnosed with menopause. So I've been menopausal in the last 5 years. So there's a lot of things that my family has just seen within my medical problems, and that stopped. I still say on my health, because really talking about my health, people know I'm very strong, of course. I survived a lot. I became a refugee in Europe at the age of 18 when I came out of hospital. You know, I ended up in a refugee camps before we even knew about refugee camps, you know. So I always been a very, very strong young woman, and now an older woman. So I always knew what I wanted, and I always had no problem saying it. But the thing is, when it comes to talking about a sense, I think is that we need to really pick and choose as well. Because for me, like, safe space is really important, right? So we could talk about all of this today, and somebody can send me a message and said, you know, I had this, like, what do we have in place? How can we talk about it? So for me, those are the really, really important thing, to make sure that you always listen, you know, educate yourself all. And not just FGM. The world is not cruel, but the people in it can be cruel. So it's really just being strong and standing up and having your voice heard, speak up, but at least having that safe space for everybody as well. So one of the things I found it really, really hard was that we were always told FGM is an issue. I was hospital, so I would go to school, so I would talk about that. It's like, oh, we really don't want to talk about that, because that doesn't happen here. That happens in Africa. So the more I educated myself, and the more, of course, I learned English now. I'm a citizen of the country, and I'm like, excuse me, how? So that is one of the problems, was that when FGM, first of all, wasn't talked about, it was happening to the black and the brown girls. It wasn't happening to the blonde with the blue-eyed girl, right? So there's a lot of that difference as well, and saying, oh, we're not going to talk about, it's a cultural thing. The main thing that always came out was it's a cultural sensitivity. We really can't talk about that. And I'm like, so if a child is being raped, child is being violated, child is in the private parts has been cut, that is still cultural sensitivity? FGM is not an African issue. FGM, female genital mutilation, is a global issue. We have, if you look on YouTube, FGM and the USA, who still says now in America, they say it doesn't happen. We know that it happened in 1948. There was a white woman at the age of 3. She was cut and had type 3 FGM, right? And she was from Texas. Then we have in Russia, FGM is practicing everywhere. It happens in Russia. Now we have the Indian community, the Bahara community who I work with right now in my schools, practice. So we know that the last 70 million women and girls who the data, when it changed, it was from Malaysia and Indonesia, right? So we never talked about that. My problem always go back to giving help and support for those who need. And the reason that it really made me upset that our doctors or the policymakers or teachers will look away was that they will think about me like, oh, Hoda had FGM. But if my best friend from India had FGM, or if my best friend from Malaysia had FGM, so what is that telling us? So one, we are discriminating in black girls, saying, oh, we only have to black girls. However, you have at least another 100 million women and girls who are North Africa, who have FGM, who are suffering with the psychological effects, who are suffering like me, the gynecological effects. But you're not helping them because you're not talking about them, because you're not saying it doesn't happen to them. So either way, it's not right and it's not fair. And that is what we need to educate ourselves. And that is what we need to make sure our voices, when we are talking, that they hear, that we are passing the right message to tell them, that correct them. When they come to you and say FGM only happens in Somalia or in East Africa, 98%, regardless of where it happens, one child is too many. I don't care if you practice 1% or if you practice 98%. A one child is too many. And that's how I feel about it. Well, you always inspire me. I'll tell you something. I really do get inspired by the youth of today. The youth of today have a lot more louder voice and more bolder than we were. So I really get inspired to each and one of you. And I think that you should keep up of what you were doing, because you might think role model is always somebody who's older than you, but your role model can be somebody who's younger than you. And I really do believe that. So I thank you all, and I want you to keep on doing what you're doing, because you're definitely going to change our world for the better, for the better. For me, what inspired me, I really get inspired by just living, right? I mean, we are talking about FGM, and people always say to me, you went through all of this and you're smiling, Hoda. I think for me, I'm just grateful to be alive, because I think as a child going through FGM, and then a year later going through 2 civil wars in my country. So, and being in hospital, and then coming to Europe, becoming a refugee, not speaking a word of English, right? Let alone that I'm talking to you like this now, I'm very grateful. I'm very grateful for those. I'm very grateful for the people who along the way help me and support me. But I think for me, my biggest inspiration is looking at my nieces and nephews. And I know you've seen them because you follow me on Instagram, and you know how much I love them. For me, my inspiration is that, yes, I can't have children. Yes, I cannot give birth to my own. But guess what? I am so blessed for all the kids and all the babies that who's around me and needs my attention and call me and say, auntie. And sometimes actually not having kids is the best thing, because you become the favorite auntie, by the way. But for me is that, and I think my dad as well, my dad is an inspiration to me. My dad was at the age of 5 years old when was in a boarding school in Somalia, and Italian boarding school. So for me, I think it's the experience in my life that I get inspiration from, and like I said, the youth from all of you. So if it's from my nieces and my nephews, from my dad and my husband, it's what I get. And I think it's nice to give love. I think regardless of how we feel for the day, to at least say somebody, how are you today? I love you. I'm thinking of you. Is a big thing. So for me, I can't put one thing, but all those many things together, what really gives me the inspiration. And knowing as well that I was cut in Somalia, and I left all those girls, my friends, who have been cut, but never had the chance that I have. You know, they're still in Somalia. They are sometimes, some of them are still living in refugee camps in East Africa, and I'm here. I survived all of those. I worked hard to become a nurse, which is something I love doing. And so it's like, it is my duty to educate and to be kind and hopefully live in a better world. So that is me. I think the lack of awareness was always something that, it's not even lack of awareness. FGM is not something that people talk about, or, you know, run around and say, I have it. If it happens within community, the community knows. But if there's another community around it that who don't know about the cutting, they're not going to go and talk to them. And secondly, it's about talking about women's private parts as well. How many of you know that people can sit around and talk about women's private part openly? You know, even in here in the UK, if you actually say the vagina, they're like, oh dear, you know, and I'm like, what is the problem? So people don't really want to hear about women's private parts, but it's the lack of education. Because, like I said, going back to earlier when it was about FGM to African girls, now the education wasn't there. So if you are a doctor, if you are a nurse, or if you are a midwife, teacher, like if you've never been educated about FGM, how are you going to bring that to your classroom? How are you going to bring that to patients? So it is about the education. It's about not having none of that. And because now, especially here in the UK, I can talk about London, is that we survivors who are professional, by the way, we were like, this is unacceptable. Secondly, we have safeguarding. You know, every school, every hospital, at least once a year, we start safeguard training. But the safeguarding training never talked about FGM. So how are you going to teach me as a teacher to have safeguarding training, but you're not telling me everything I need to safeguard my children from? So it's that lack of, say, it happens somewhere, it's not a problem. We don't need to talk about it. It stays underground because the community don't want to talk about it. So that is one of the main reasons, is that it's picking and choosing what we educate from each other. So FGM is a child abuse. FGM is about issues about safeguarding. If you're going to teach somebody about safeguarding, FGM should be in there, you know. And so I think it was the lack of it and not talking about it. And that means it gives more power to the communities who practice, who are ground. It gives them more voice because like they don't want to talk about it, which is great for us. So we need to break that. So I think the more we talk about, the more we educate each other, the more especially we provide trainings for those who are there in front line to help. You know, doctors, nurses, midwives, teachers, teacher assistants need to know this. They need to know to help their children, their patients, their community. I think that every single health professional. Now, when I go to a clinic, and so I'm a sexual health and HIV nurse, right? All my life, I work around humans' private parts. It's like my life that's what it is. But it's about talking. It's about providing services for those who need services. So for me, I'm not saying my patients are more important. Like my patient is not, my patient is FGM survivor, or I have another patient. They're not more than important than each other. Might be all of them. However, we need to provide services. How are we going to help anybody or educate doctors or nurses when we don't have services for these patients, right? We have women who come to submit tests and they have type 3 FGM. And the doctor never asked them if they had FGM, but the doctor will send them to go and have their submit test done. How on earth are you going to accept that patient? How are you going to put a speculum, not even examine, let alone to do anything? Right? So that we need really, as a health, especially the policymakers, the chief executives, so they need to together. It's an issue that will always affect the NHS. We will be there seeking help and support and medical help. So we need to make sure we provide the services that these women and children need. As long as we don't have that, I don't think none of us gonna learn as well. Because as a health professional, you're not gonna learn if you don't have a service for certain patients, right? Because it's not that important into the line of learning as well. So these are the things we need to change. If we do not change the law and the way it is, we are not gonna get anywhere. So I say to each and one of you who are health professionals, who are teachers, take that upon yourself and use the law and demand what you need to learn. Because as a teacher, you could say, listen, where's my training for FGM? It's mandatory. They have to, but guess what? It's a pick and choose. One school will do the whole hour of safe FGM training for the for the teachers and non-teachers, but then the next school next door have never done FGM for their staff. So there's a big gap. There's a big gap, and the gap is that the law is not that strong. The law is saying that it's mandatory. However, you choose how you do it. No, safeguarding is safeguarding. Every child matters. Every single child, regardless of color, religion, refugee or not, wherever they came from, every single child have those rights. So we need to make sure we provide the services for the frontline service training that needed and the knowledge need, and provide the service so we can help somebody who had FGM. So if that patient comes and you realize, oh, I was going to do your SMA test, but I just realized I can't do your SMA test because you had type 3 FGM. You never had the operation. So that will put me as a nurse in a really uncomfortable place as well, right? And that will put the patient in an uncomfortable place. However, you're going to have to talk to your patient like that, because there is no way on hell you're going to be able to do that test for that patient. So you're going to have to tell that patient now they have to go to the specialist clinic to be reopened, have all of that, and then go back. Now, if we are not provided as a health professionals all of these things in our doorstep, how are we going to help that patient? And how am I going to feel as a nurse if I never had FGM training? If nobody's spoken to me about FGM, how am I going to take care of that patient? So demand, demand, demand. You know, you have to protect yourself, especially when you are a health professional. And here in the UK, we said what you haven't written down has never happened. As a nurse, I will make sure that I take care of me, I take care of my patient, and when I see a gap, I speak up. The whole reason, me, of course, doing the work that I started doing in NHS is I demanded it. I called the IT department manager, I called the chief executive of the hospital, and I called the head of the gynecologist, and I put everything on the table. And I said, a patient like me comes to your clinic today, who had FGM type 3, who had the psychological problems. How are you going to help that patient? What have you got in place for that patient? I'm talking about the early, when we did about 2003 and stuff, right? 2004, nothing. We as a sexual health nurse will ask our patients everything that was private. Your sexual contact, who did you have sex, but we never asked them about FGM. So I say to them, how do you gonna know? We don't even have the right data. And that is one of the reasons we do not have the right data in here, anywhere in the world, because nobody recorded women and girls who had FGM. So I spoke to the IT department. I said, every question that we have, you need to add 3 questions there. I want you to add, have you had FGM? Yes or no. What type 1 to 4, unknown, because a lot of my patients did not even know what they had. And then you will have an open space where you're going to write anything that you need to write. So if another nurse, another doctor sees the note, they know exactly what's been said and what's been done. I have to single-handedly fight for that. That wasn't my job. Right? So there are a lot of things that if you believe in it, you're going to have to stand up and do it. I think for each and one of us do want to live a world that is free from harm, regardless of where you are coming from. I think what you could do and what everybody can do is that make sure you know, and I keep saying education to me is the heart of me. Make sure that you know everything yourself. However, once you educate yourself, you really could see the difference. You might see it could be the woman that next door to your house. It could be the woman that who you say good morning every morning when you go to the shop to buy your coffee. It could be the person that who delivers your newspaper every day. It's about just knowing and being kind to the others. Once you know something, it's only then can you help someone else. There is not one thing I can ask you all to do, but one thing you can do is that there's a lot of charities now that are there. There's a lot of people who are actually survivors-led. who are actually doing the grassroots work. They don't get funding from government. Nobody recognizes what they do, but we believe in it. And I believe in, like I believe in Five Ventures, because I know we will reach and we will educate and we will bring young people more into it. Please do what you can by bringing young people together, by educating each other, by talking about that. Even if you are privileged in your country, in where you are, they ask another child who is not that privileged, right? Share information, be active on social media, go to those charities, write to them, see what you can do. Even if you can donate 1 hour of your day a week, or if you can donate 1 day a week to those charities, it will be something that they will need, because they need that support. And for you is be active, get people together, you do your organization, you be the voice that speaks for half of those 200 million women. Because I really think that by being heard and by owning our voice, by bringing young people together, bringing to debate, to debate why does it happen. I don't want young people just to think that happens in somewhere in Somalia, but it didn't happen in here, so it's nothing to do with me. No, each and one of us have that voice. So please, you guys are the future. You are the future generation. Don't shy away. Like I said, own your voice, stand your ground, but be active, support us, give us as much support as you can. Whatever time you can donate will be great. And just bring young people together. Organize your own little group. Like have those kind of, like once a month, every 2 weeks, say, you know what? We're going to talk about issues that's affecting the world today. So today we might talk about FGM. Next week we might talk about coronavirus. How did that affect? There will be a lot of things, a lot of different things, but just bringing it together, all of you being together and having that discussion, I think it's a great point to start. I think one thing was for us as well, me and Mabel, who is my co-founder, was when people talk about FGM, it was always like, oh, I'm so sorry. Are you okay? And it was like, listen, when I'm talking to you, I'm laughing. However, what happened, let's go and change tomorrow. So I met Mabel when I was invited to a performing art college that she was going to as a 17-year-old. And it was the first time that when I was talking, so the teacher knew about FGM and she invited me to do a talk for the students. And I remember talking about, and I said to them, I showed 2 billboards, anti-FGM billboard. One was from Uganda and one was from Somalia, especially the city I was cut, where I was born. And I said to them that when we talk about FGM, everybody says, oh, the countries that practice, they don't know nothing, they don't want to end it. I said, look, this billboard, anti-FGM billboard, talks about the harm that comes from FGM, the medical setting. I said, can you believe we are living one of the richest countries in Europe and we never had anything like that? And that for them set it up in their head. They were like, no. So that's how the Ventures were born. Mabel went back to her parents, the other kids went back, and they were like, listen, we're gonna raise money so we can do an anti-FGM billboard here in London. And that's how it was born. And then that first night, it was amazing because we had one of the most beautiful venues in London. We had art that was donated to us. We had poets, we had singers, we had comedians, and it was such a beautiful night. And we raised over £15,000, which we use for an anti-FGM billboard for the first in all of Europe in London. And then everybody was saying it was a great night, why can't we keep it up? So we kept it. So every couple of months, different artists, especially, the poets, the artists that people don't give attention or put them in a platform, we get them, they come, they perform, and wherever money that is raised through the night goes to different charities. So like Dahlia Project and all the other FGM charities who are working in the community, the money goes back. However, 3 months ago, we registered as a charity ourselves. So now we are just going through the process of actually learning about having a charity that is registered. Because for us, we were in the middle. We were bringing the art and the organizations together. So now we're going to do that. But everything we do is about music, it's about laughter, it's about outspoken words, it's about poetry. Any of you watching tonight, if you wanted to be part of the next Avengers event, be part of it. That is what we wanted to do. I just don't want to be feeling sad. No, we party and we learn, we laugh again, and then we raise money. My co-founder is riding a bicycle from London to Glasgow for 10 days. And I think today is the 7th day. So I would love if you can guys support, please support, share, donate what you can, spread the word. And what we wanted to really do is that Dahlia Project is the only clinic in the whole of Europe who helps women and girls who have gone through FGM when it comes to psychologically. They don't get money from the government. They survive on donation from the greatness of humans. And so wherever money Mabel raises now is we're going to match fund it, and that money is going to go to the Dahlia Project. That means that we can help more women to have a therapy sessions, and each woman will get, actually I think it's like £100, will get like 6 weeks of therapy, healthcare, traveling, everything is provided. So please share and let everybody hear our voice.
Absolutely, everybody make sure to check out the Vavengers on Instagram after the session. Like Hoda said, their co-founder Mabel is cycling all across the UK to raise awareness for it, and they support the Dahlia Project through those funds. And Dr. Leila Hussain does a lot of work with the Dahlia Project and supports these girls and women and provides them the psychological care that they need. So make sure to check out Vavengers after the webinar and support the work that they're doing. So just moving on from that, there was a question that a lot of people had asked about FGM being performed in India. So FGM is performed in India, but what happens in India is the government of India officially believes that FGM does not exist. So they've gone on record. So government of India officials have gone on record and said, FGM does not happen in India. It's not happening in our country. It doesn't exist in India. However, it does. It happens in Maharashtra, Kerala, Gujarat. It happens in the Bora community in India. So 80% of survivors from that community, they did a survey where it showed that 80% of girls and women from the Bora community undergo this practice. And so We Speak Out, which is a famous survivor-led FGM organization, wrote about it in a report, and several lawyers, leading FGM organizations in India have tried to bring about petitions and bring the issue to light. However, the government of India refuses to acknowledge that the practice exists. So for those of you watching the webinar from India, as individuals, it's important for us to talk about this with your friends, your family, in your community, so that we can recognize, so that the government can recognize it exists and invest in the correct resources to help like girls and women in India. Thank you so much, Hoda, for joining our very first Scarlet Udaan webinar. And everyone here, please make sure to check out Vavengers, like Hoda said, on Instagram and support their page and go and support the co-founder, Mabel, and her journey right now. Thank you, everybody, for joining and attending our very first webinar. Before we end the virtual session, we'd just like to take a screenshot picture. If everyone could turn on your cameras, and we can just take a quick picture before we end the session. Awesome. So 3, 2, 1. Yay. Thank you so much, everyone, for attending our session. And thank you so much, Hoda, for being here. Thank you, everyone. Have a nice day. Bye.
Thank you for having me, and please don't shy away. Bye.
Thank you so much, Hoda. Bye-bye.